Welcome to Dental XP. I'm very happy to bring to you tonight somebody who is an exceptional teacher, colleague, friend, and I've been really not only been exposed to Eric's work for many years, but had the opportunity of going and seeing him in his own home country of Belgium many, many years ago with my brother Henry, where we did a course with him. He has developed material for teaching and has always been at the cutting edge of much of what you are going to be seeing in just a moment. Eric, I'd like to welcome you, Dr. Eric Van Dooren, to Dental XP.
Thank you.
Eric has been working with implants and cosmetic dental procedures both on the surgical end and on the prosthetic end. So in many ways, he's both periodontally and prosthetically trained. And Eric, you really have always been able to bring in new techniques to your practice. You've always had an eye out when you saw something interesting and immediately learn it and develop it further. I mean, from orthodontics, I mean, you brought us there before some of our articles were even published. Once you saw us, you implemented it in your daily routine. You've done periodontal plastic surgery, implants, implant prosthetics. What is exciting you these days? What's new in your practice, and where do you see the future in the next few years? How are things going to change?
I think that what I saw the last years, the difference is maybe trying to be minimally invasive. I think for our patients also, we try to include procedures that are minimally invasive. Secondly, I think the future is really all ceramic. And the third point maybe is that the CAD/CAM technology is going to bring us really fascinating things, I think, for the next few years. And if we combine these three things, I think we will have a bright future in dentistry, in aesthetic dentistry.
Fantastic. I happen to think that you're absolutely right. In terms of minimally invasive surgery, because I really think that we've heard a lot about all ceramic systems and the push towards that, and of course the excitement of CAD/CAM technology and 3D imaging, all making things easier, making us more precise and avoiding problems. Minimally invasive surgery, and I want to focus on that for a moment. A lot of people say it. It means different things for different people. What to you is correct in what is minimally invasive surgery?
I think I'm not talking as much from a point of view of guided surgeries, computer-guided stuff. For me, minimally invasive is quite simple. It's avoiding vertical incisions, for example, in periodontal plastic surgery. It's including orthodontics, like you showed us brilliantly when you came to Antwerp. I think this has changed our life, like orthodontics to solve the vertical problems. We all know the vertical problems are the difficult ones to solve. So is really very conceptual. I mean, the concept is try to incorporate techniques that will allow you to be less traumatic for the patient and less traumatic in your surgery.
I think it's outstandingly said, because a lot of people call MIS, or minimally invasive surgery. I see it on the screen, all the lectures, everybody becomes a minimally invasive surgical specialist. And I think what you just said is very true. You have so many things in your armamentarium, in your toolbox, because you went and you learned them and you applied them slowly over time and you developed those skills. Your skills in orthodontics, you use it to develop the vertical component, which is much more difficult. It limits the amount of surgical trauma to the patient to build up bone that you're missing. And then in terms of placing the implants, once the vertical has been established, it really makes those procedures less, not only less traumatic, but less of a problem in terms of compromising vascularity, blood supply, fibrous tissue ingrowth, scarring, and in many cases, recession of the soft tissues, which is so vital to aesthetics. What we're about to see, I know with your presentation in just a moment, are you going to be lending a little bit of that information to us? And then what would you tell our viewers in terms of being careful with minimally invasive surgery? Some people think minimally invasive surgery means I don't raise a flap at all, that I put the implants right through the tissue. Some people get into trouble with minimally invasive surgery. And what would you tell somebody who's a novice, an inexperienced person? What should they be careful of?
I think for me the problem is really the industry giving us the wrong information, because they are telling us that flapless surgery, for example, is easy surgery. It is not at all. I think you need some experience. You need to watch like the e-learning or the e-teaching, see a lot of surgeries, and once you know this, then probably you can shift to flapless. I think it's not really intelligent to lean towards flapless immediately if you're a non-experienced surgeon.
Yeah, it's very interesting. A lot of people say when you're just starting, a lot of the push in teaching and from industry is it's very easy, just drill through the tissue. But in fact, what you're saying is you actually need to be much more experienced to work in a blind environment.
I think so. And I think you will agree with me.
I agree with you completely, and I think some of the people who are out there who are just going to courses, because some of the people who are learning, when they start out, they may be told things that are not factual, to drill right through the tissue. First of all, another problem with drilling through the tissue, not only do you not see the bony anatomy, and you should use CTs to know where the bony anatomy is, but sometimes when you drill through the tissue, you're drilling not where the attached gingiva is.
This is something that I want to point out again. This is something from the industry, but completely the wrong direction, according to me, and probably according to a few of my colleagues. I think you also. That is the importance of having attached functional tissue around the tooth and around an implant. I think that's really the main thing. So for some people, it's difficult to go flapless and drill through the tissue, and probably they don't really even understand the importance of having this functional attached thick tissue. And I think this is the prerequisite to have long-lasting aesthetic and functional results in most of the cases.
I agree with you completely. Now you understand why I want to bring him to Dental XP. We're about to see a presentation, and I think you'll all be very happy. He's really one of the real stars in the whole world in teaching these aesthetic principles to us. So thank you, Eric, for being with us today.
Thank you. Thank you.